Access to contraception means a lot to women and girls in Uganda because Uganda is one of the countries that's still struggling with a high maternal mortality ratio. The penetration of the public sector to go out and in the very rural communities to meet the very last person is minimal. So that affects access so much. The partnership is really one of those very strong partnerships. MSI also works with our healthcare workers in the government, the mainstream public sector, and supports them in building their capacity, especially for the long-term family planning methods. They help the public sector to bridge the gap. They go where the access to contraception from the public sector is minimal.
Our approach is to partner with the local governments and get them to understand, first of all, the importance of family planning and how it will help in delivering a better maternity health care package for their constituents. And once we have the local government on board, then the district health team is part of that, and then we get introduced into the communities.
We work together as a team. Basically, it has taken us through community advocacy, through community dialogues, through community sensitization. Also done some mentorships and coaching at facility level, especially at lower centers, in those facilities which are not reached. We usually have what we call performance review meeting. Each facility presents its data and we identify gaps and work on them as a team.
I didn't have much confidence in offering long-term methods of family planning, but since we started partnering, they trained us, they trained me, I became confident, and I also started training my fellow service providers. Also, counseling was also very poor. Even the data quality was not good, but there was a great improvement.
Traditionally, the way our public health facilities are set up, they're not traditionally very inviting for young people. But when you do the work to build competence for health workers to know how to talk to and address young people, then you make a difference. So during the time we have been working in public sector, we have seen the proportion of young people we are serving grow from 9% in 2018 now to 14% in 2022.
Habokuba nenyamba kugumiza mle msomo yange and they prepare for the good future.
I want to say that the future of the partnership between MSI and the Government of Uganda or Ministry of Health is something that we need to nurture and support. We can work together and map out areas where we think our access is very minimal to go and bridge the gap.
Access to contraception is doing wonders for women in this country. Because we're building capacity within government-owned facilities, it means that even long after MSI has stepped out, ideally, these services should be able to continue. It's there today, it's there tomorrow. Every time women and girls walk into these facilities, they receive services by members of their communities, people that they trust. And that really does help with acceptance, it does help with busting stigma.